When Burundi's president Evariste Ndashimiye declared coronavirus the biggest threat to the country last week, his government swung into action. Temporary testing centers have been hurriedly set up in open fields in the commercial capital Bujumbura. Health workers are urging people to get tested, and many like NAHIMANA MEDIATRICE are volunteering.
The problem with this pandemic is that it spreads easily. It's also difficult to protect yourself. This exercise is a good move by the government because if you have symptoms or not, you can still get tested.
It has been a total change of policy from the previous government led by the late President Pierre Nkurunziza, who said Burundi is protected by God, refused to enforce strict social distancing measures, and expelled World Health Organization officials who raised concerns. The shift in tone by the new president comes as the number of confirmed cases rises as more people get tested.
We have enough supplies, including testing kits. We have provided everyone at the testing centers with the masks.
In Kenya, President UHURU KENYATTA has announced a phased lifting of its lockdown, despite coronavirus cases increasing. People can now move freely across the country. Churches and mosques are to reopen, but with some conditions. Domestic flights are to resume later this month, and international travel in August.
Should the situation deteriorate and pose a challenge to our health infrastructure, we will have to revert back to lockdown.
South Africa has seen the worst outbreak in the region and imposed some of the harshest measures, which are now being eased. Children in 6th and 11th grades have returned back to class after 4 months. Other governments on the continent are also cautiously lifting restrictions to help their struggling economies. Millions of people have lost their jobs.
And the countries where you've seen the lockdowns being most effective are the countries that really foregrounded a lot of the work of public awareness and beefing up institution and beefing up monitoring of cases. But I think in countries where you had that half-half non-committal almost response or a slow response, then where they're stuck in these cycles of lockdowns and reopenings and surges.
The Africa Center for Disease Control says more than 400,000 people in Africa have tested positive for COVID-19. The World Health Organization is worried the virus is now spreading widely across the continent, which could make it the next epicenter. Catherine Soy, Al Jazeera.